and he slept with them raw without condom. And he paid each of them 200. There was this patient that was admitted. So when we checked, he was also HIV positive. So we placed him on TB drugs and set HIV drugs. He was taking it. So very shortly before the man gave up, he called me and other of my fellow colleagues and handed over a list of girls that he slept with, over 200 girls thereabout. I was like, what happened? What are we going to do with this list? He now said that we should do what we call contact tricks of this girl. Their names with their number is there. I slept with them, and he slept with them raw, without condom. We are like, why did you do this type of thing? Don't you know it's bad? So you know that you are HIV positive and you went and slept with all these girls. He now said that we will not understand that it was a girl that gave it to him. So therefore, he vowed that he must give it to them before he died. I am Reverend Sister Elizabeth of the Handmaids of the Holy Child Jesus congregation.
Okay, you're welcome to Adult Gist podcast.
Thank you.
Okay, we'd like to get a brief background of your profession, your specialty, and where you work currently.
All right. I'm a registered nurse by profession and also specialized as a midwife. I had my BSc in nursing and master's in nursing education. I work currently at Chukwuemeka Odumegwu University Teaching Hospital, Amak, Oka. I journey with women. I work in different units there. But currently, I am the senior nursing officer of the private ward. Thank you.
Okay. It's going to be very interactive. I want you to relax and not be too formal.
All right.
Okay. So, considering your area of specialty, how is childbirth in Nigeria? How has it been so far?
Giving birth in Nigeria is something that women enjoy doing. But the problem you have today is what we call maternal mortality rate is of high increase. That is the death of mother and the cost of giving birth. And sometimes the children also died in the cost of trying to deliver the baby. A lot of things are the cause of this. One is that some of our women does not believe in the hospital any longer. They prefer going to what we call TBA, traditional birth attendants. That is what I mean by that are those that deliver at home, saying that they have the gift from God and they know how to deliver women. So they prefer going there, and sometimes they come up with a lot of complications that before they could transfer the woman to the hospital, the woman may die in the process, or the baby will die in utero, that is inside the womb. In addition to that, why some of our women doesn't like coming to the hospital is just because of the hospital setup. One is that it is not accessible for them. Secondly, it's not affordable. Thirdly, it's not efficiently and effectively run. That is, they don't have all the equipment, the drugs, and what it needs to manage this. So sometimes they don't want to go there. And sometimes the cost of delivering the hospital is highly expensive. So they prefer going to where it will be low. The cost is very low. And they end up complicating their lives and the lives of their babies.
So, so far, have you had any experience of that? A woman trying to give birth at home and then things becomes complicated and they rush her to the hospital and all that?
Yes, I've had series of experiences where I work. But I will just share one. There's this woman that she registered in the hospital for antenatal, and she was coming for antenatal. I sent her registered in this TBA, traditional birth attendant. So during the time of delivery, she went there to deliver. She labored for two days, and the baby is not coming out, and she stayed there. So unfortunately for her, she called me and told me that she has been in labor for some time and she's somewhere And I told them, Mother, how many days have you been? They said 2 days. I said, please, can you come to the hospital? She said she does not have the money to come to the hospital. And I told her, okay, you can enter keke, come, I will pay for the transfer, which they did with the husband. They came to the hospital. But before they could arrive, I checked the baby. The baby had already died. So, and the woman is already distressed. She's in pain, she's restless, and she's going. So we took her into the theater. We had to kind of do operation on her to bring out the baby. So when we brought out the baby, after we brought out the baby already dead. Then after 2 hours, the woman gave up. So it's quite unfortunate, but I don't know who we're going to blame. Are we going to blame the woman? Are we going to blame our economic? Are we going to blame the status in us? What is happening in our country today? I don't know. But the question is that we need to put hand on deck to see how we can solve this problem.
So, considering the cost of giving birth in the hospital, what is the government doing about reducing the cost?
Actually, I can't really say what the government is doing, because if the government is really doing something, you will see some women patronizing the hospital. But as it is now, the women are still patronizing these traditional birth attendants. They are still going to deliver because they don't have the money. If you go to the hospital to deliver, they will bill you for many things. You understand?
Things like?
They will bill you like what you use to deliver, the tissue, the epistome, now the cut they will give you. They will bill you for drugs. They will bill you for many things. So at the end of the day, we're thinking of some people can pay 100, some 200. And unfortunately, if you end up in cesarean section, which is cutting off the operation, you may even pay up to 300,000 to 400,000. So some persons, they don't have such amount. Even where they work, say some of them have been paid 30,000, 40,000. So where would we have up to 300 to come and deliver just one baby in the hospital? It's not possible. And those that try to come to the hospital to deliver, most of them are in the hospital now where I work. They can't pay. They've been there for 2 to 3 months. They can't even pay the hospital bill. So they're just there waiting for maybe a philanthropist who will come and clear the bill. So we need the government to come up to see how to kind of subsidize the hospital bill, the rates, and there are things that have been done in the hospital, like the drug that has been used to manage people in the hospital, and the workers, they should be paid by the government, and see how they can help so that these women can access the hospital in an affordable price.
Okay, so I heard that there are some cases whereby a woman wants to give birth and a certain amount is needed for a cesarean section, and the hospital say they must pay before it will be done. Why? Isn't that wickedness?
No, I can't say it's wickedness, because every business needs money to run the business. Nobody wants to go into bankrupt. Like in the hospital is like a business that it's a profit-oriented business. You understand? But if the government comes in to subsidize, you find out that the profit will not be much again. It will be as lower rates. So that is why when you come to the hospital, they will ask you to pay first before they will carry out any services. Because they're going to use drug, they're going to use human services. So the human being need to be paid. They're also going to use other equipment that need to be kind of maintained and also sterilized. So they need money to do all these things. So that is why when you come to the hospital, we'll ask you to pay before they carry out those services on you.
But
So,
life is in danger at this point.
Oh yes, you can take it to that way, because our profession, we call for empathy and sympathetic, to be empathy and also save life. But in another way, if you are, just as I said, if you go to the hospital, you see many people lying down there. They did cesarean surgery on them, some of them 400, 350. There are many of them, 3 months, 2 months, they're still there. And you see that the hospital cannot get money to buy all those things to equip the hospital back to take care of others. That's why they try to stiffen up. When you come, they will ask you to pay first before they carry out that service, which is not supposed to be, because we are meant to save life. But if the government come into it and see how they can help, because people are dying. People are dying. Our mothers are dying. Our children are dying. People are dying because they cannot access the hospital any longer. There is no money, there is no capital, there is no work. But if the government can come in to see how they can help, you will see that A lot of things we put in place. So when somebody come into the hospital, they will remember their ethics of saving life first and attend to the person before you begin to think about money. So I don't think it's wickedness.
No, thank you. I've been clarified on that.
Thank you, sir.
Okay, there is this rumor that some hospitals sell placenta or they take child's placenta after giving birth. And what do you have to say about that? What is the importance of a child placenta and what do hospitals do with it?
There is this saying that when you are doing something and you are stick on that, they say is a placenta buried there. Don't know if you have something like that.
Yes.
Is a placenta buried in that thing that you cannot move from that place. In the hospital, when you deliver a baby, that placenta, the placenta is, what we mean by placenta is that which is attached to the mother, through which the baby feeds from the mother, through which the baby gets air, and also excretes some carbon dioxide waste to the mother. So it's just that a kind of bond, what connects mother and a child in utero. So when you deliver the child, you cut off the placenta and you go and bury it. We buried it. We don't sell it. We don't sell it. You bury it. So but sometimes some parents or some mothers ask, request for it, that they want to go home with it, want to go and bury it to their house. You give them because it's their right. It's a part of their body. So we don't sell it, we bury it.
Okay. Does placenta have any health benefits if processed into drugs or other things?
I don't understand. Is it after you have been delivered the mother, when it's inside the
No. After birth.
After birth, no, I don't think. Once it's out of the mother, it's no longer life something. It's already just like somebody that just died. So it's no longer part of it. So everything has died. Both the blood vessels is dead. So that's why we buried it. But because it's something that connects the mother and the child, sometimes they want to take you home to bury it the way they used to bury something.
Okay, thank you. It seems that cancer in women has been increasing lately. So what do you have to say about that? What is the cause and what are the different types of cancer and how to prevent them?
Well, this is quite interesting topic. Cancer, we have known, has become something that is raising an eyebrow in our country, Nigeria, though all over the world, but in Nigeria, it has become something that is now an increasing part of it. Because if you go to the hospital, especially where I worked, if we have up to 100 patients on admission, 80 comes down with cancer of different parts of the body. It could be cancer of the breast, it could be cancer of the scrotum, cancer of the stomach, cancer of the liver, cancer of the neck, cancer of the brain, cancer of the neck, or cancer of the skin. So it has become it's alarming the way people are suffering from cancer. And it doesn't have age limits. Some are children, some are adults, some are elders. So everybody is having this. Many people in the hospital now is suffering this cancer. Why I am so interested in this topic, because most of our people are ignorant of the causes of this cancer. Though they say it's hereditary. It is hereditary, but there are some predisposing factors, that is things that can expose you to it. One of it is what we eat this day, our food, what we consume, both food, drink, and what we eat and the fruit we eat. Because most of these food now are genetically made. Our people are no longer allowing the fruits, the food, and everything we take today to come out natural. Rather, they use a kind of fertilizer, different chemical to ripen the fruit, to ripen the food we eat and everything. Because of what? Everybody wants to make money. Everybody wants to take it to the market and sell it to make money. And they end up jeopardizing the lives of our people, putting them into danger. Then that is, apart from nutrition, another thing is what we apply in our body. All these creams we buy, if you go, sometimes you see where they write it, they contain some elements, some things that is acidic and is poisonous to the body. The deodorant we use in our armpits sometimes has this way of causing cancer, a kind of gene mutation, causing our cells to proliferate, especially in women. it mimic what we call estrogen that can affect the woman breast. And another side, the drink we drink, those drink we drink like some water we take. When they are being exposed in the store, in this ultraviolet X-ray, when they affect those drinks, especially the water we take, sometimes that plastic in which that water is inside can melt and now expose some radicals, some chemicals that can also affect our health. Aside all these things I mentioned, there are other things also that can predispose us to cancer. Another one is not exposing yourself to exercise. Some people don't do exercise. Sentimental lifestyle, always eating, sit, eat. You don't do exercise. To exercise all part of the body, this can also predispose you to. Then the drugs we take, sometimes can predispose you to this cancer, especially those what women takes, either as fertility drugs. All those drugs can also, and sometimes they take it as a family planning drug. Those drugs can expose you to cancer. So all these things causes cancer. Then food. In the olden days, our mothers used to go to farm, pluck vegetable, get fresh tomatoes, prepare food for us. Sometimes they even use palm nuts to prepare food for us. But these days, our women prefer going to buy canned rice, canned meat, canned tomatoes, everything canned. And you know that those things are preserved. The preservative they use is chemical. And these chemicals are also inside it. So sometimes if you don't cook it well, it has this way of dealing with us inside our body. So all these things are causes. But why I'm here today is to know way forward. What can we do to see that we prevent this ugly incident called cancer that is eating the lives of our people, that is killing us? One is that one of the preventive measures is that first of all, we should mind what we eat and what to consume. Secondly, we should go to hospital to do some checkup and then check our annually, if it's annually or quarterly, to check our health. Then thirdly, if you have been diagnosed that you have cancer, you don't have to deny it. You have to accept it. And when you accept it, start treatment on time, because they say prevention is better than cure. Earlier is better than to save. So when you start it, you can also save your life. If whatever they ask you to do, do it on time. Don't start denying. And don't start going from one church to another. Say that pastor told me that it's in the air. They inject it, they send it, and all those stuff. No, it's not helping us. Rather, go and assess medical treatment so that you get better and live the more years God wants you to live. Thank you.
Okay, thank you. With your experience, what are the different types of cancer you've witnessed from patients? And tell us about your experience in real life.
Okay, I experienced cancer of breast, cancer of the throat, cancer of the stomach, and cancer of the testis. When I mean testis, is the private part of a man. Now, there was this woman I nursed in my ward that came up with cancer of the breast. There were two. One is barrister, one is an educationist. So they came for chemo. They were diagnosed. Both of them were diagnosed with cancer of the breast. So they were diagnosed for that. So they came for chemo, and they gave them the first chemo. Asked them to return back next week for chemo. They never returned back. The other one went to church. The other one went to her pastor. You know, after 3 or 4 months, they came back so bad. And I was like, why did people come for your continuation of your treatment? They say, this one told me that he went to the church and they told her that when the pastor called the name of those who are sick, and they called her name, so she came out and the pastor said that today your sickness is gone and you are okay. So she felt that she's okay. The other one, the same similar story. But unfortunately, we lost the two of them. So why I was a little bit worried is that after all their education, their enlightenment, yet they still end up being hypnotized by the so-called pastors, ministers of the church. So please, I'm addressing the public. Please know that there is, in as much that God heals, we should also know that we will have to do our own parts before God comes to heal. But if you not do your part, because God has given us that memory and understanding to know where you're sick, go to hospital, access medical care. Then adhere to what they ask you to do, then pray to God to perfect the healing. Thank you.
Are pastors making this work difficult for you?
Definitely, yes. They are really making the work more difficult and difficult for us.
Explain.
Because they will come and tell the patient that you don't have cancer. When the patient has come to the hospital, has gone to maybe 3 or 4 hospitals, he or she is being told that you have cancer, and the cancer is that stage 1 or stage 2, whereby you can be treated and you get better. Then when they go to church, the pastor will not tell them that they don't have cancer, and they should not mind them. It's one of those ways which the church want to make money, the hospital want to make money for you. So you see the person believing the pastor, and they last until when it's worse. That is when she will not come back to the hospital. So it's making us, because when do you see someone that will have lived and lived for longer time, coming back deteriorated, bad, where you cannot do anything, and then you can't do anything, you can't perform miracle again. And that is how the work becomes difficult and so challenging to us.
Why is it that, sorry, I'm going to be direct in some of these questions because that's how people feel.
But that's okay. That's okay.
But why will you not tell the person the truth that nothing can be done at that stage? Instead, you go ahead and be giving the person medicine.
Well, in our profession or in our health sector, that's what we call palliative care. And that's what we call a palliative care. Palliative care is that, in as much that you cannot cure, there are some diseases that is incurable, but you keep on treating the person, kind of treating, so the person will still be healthy, can carry out the activities of daily living. At the same time, the person can live normal like others. So that's what we call palliative care, alleviating some pain, symptoms of the death. Let's say, if you don't do it, if the person is meant to die in 2 years' time, but because you are giving that palliative care, the person can live up to 20, 25 years more before the person can go. So that's what we do. It's not that we will tell you that it's incurable. It's not only cancer that is not curable. Diabetes is not curable. Hepatitis is not curable. High blood pressure is not curable. Even HIV is not curable. But people are going around with it, and they're living healthy and comfortable.
With that being said, let's talk about hepatitis B. A lot of people don't know about it.
Okay.
What is your take on that? What is the consequences of not having the vaccine and then having hepatitis B? Tell us, what is it like?
When you hear the word hepatitis is the disease of the liver. When the liver has been diseased. And we all know that the liver does a lot of functions in the body. It does metabolism, digestion, excretion, and so on and so forth. Let me not go to that. We have different types of hepatitis. Hepatitis A, B, C, D, even E and F. We have all these hepatitis. But some of them can be curable. The one that is not curable is hepatitis B. And that is why we have hepatitis B vaccine. And you have been meant to take it so that you prevent it from not having it. You understand? But every other one can be curable, because those ones you get it from food you eat. If you don't cook your food well, you don't cook your meat well, you can get hepatitis C and thereabouts. But this one you can get it through either having contact with somebody's fluid, sexual intercourse, a kind of blood transfusion, and the other person fluid contact from the person that had it. That is where you get it. I have one ugly experience that really pisses me off. Till today, if I remember it, it gets into my nerves. I get angry. The incident was a woman who had a twin, very tender twin, boy and girl. While they were 11 years old. So this woman was sick. So she was brought to the hospital and she was diagnosed hepatitis B. So she was in the hospital with us for more than 2 months. But guess what? The people that is taking care of this woman, those twins, those 2 boys and girl, a boy and girl. And when you tell them, please ensure you maintain universal precaution. It's their mother. After they finish saying, they are children. They will hear, they will just go to the mother, touch even the physics, the excreta, the one that try to, even ask them to leave, they say, no, don't worry, it's their mother. So what happened at last that finally we lost that woman. But these children, they were taken to somewhere to school, and they happened to run a test for them, discovered that both of them were hepatitis B positive. So the father was mad. So when the father came to the hospital, I said, but we try to talk to your children to be careful, but what can we do? So it's quite, so they have to withdraw those children from school because they were boarding school. They withdraw them. And the father did not know what to do. We tried to counsel him. They have to calm down. I don't know what we can do. Have to try to manage them. So what am I saying in essence? When you know you have this infection, please try as much as possible to make sure those around you didn't get it by ensuring that they maintain the reversal precaution, whatever they are doing with you. And you too should try to protect you, try to educate them not to come close to you, because they wouldn't know. It's not showing in the face, neither would you know that somebody have it. There is no serious sign that you know. Yeah.
So when you noticed she had it, why didn't the hospital give the children vaccine?
Okay, the vaccine, you don't take it once you have it.
No, I mean the children.
The
children before they got in contact with it.
Actually, you're supposed to take the vaccine when you are small. There is some vaccination they give after birth. So it's part of it you're supposed to take. So we didn't know if the children did not take it. You understand? If we knew that they did not take it, we would have given them what we call booster. But we didn't know they did not take it. Or if they took it, it wasn't effective. We don't know. Because the way you take the vaccine matters. Yeah. Some persons, they just go to anywhere to take it. Meanwhile, you're supposed to go to primary health center to take the vaccine. So if you go to anywhere to take it, so you have taken it, but the efficacy is not there. That's the problem.
Okay. Let's talk about HIV. It seems the HIV is increasing rapidly in Nigeria. What is the cause and what's the way forward? What is your experience in the hospital? What are the records you have personally you've seen and then?
Quite interesting to talk about this. HIV, we all know, is human immune virus. It's a virus that once it enters inside you, its main target is to target your immune system and see that it destroys the immune system, suppress it. I know immune system of the body is what we call soldier of the body. It's one that fights everything that comes across you. So HIV does not kill. But what kills is the opportunity infections. So if you have HIV and you don't take care of it, then that immune system, once you enter and lower the immune system, then any infection that passes, you get it. If you cough pass, you get it. If a catarrh passes, any infection that passes across you, any virus in the air, you must get it because the soldier of the body has been destroyed. So that opportunity infections you get, what we call AIDS, is what kills. Now, the HIV, from your question, what you asked, the HIV infection is now still at increased part of it. It's still going higher and higher and higher. The reason is because one is that our people who had HIV and they knew they had HIV they come and access their drugs. But they are taking the drug based on not what to call adherence. They're taking it based on compliance. I will explain what I mean by adherence and compliance. Compliance means that I give you drug, asking you to take the drug. You took it. You take the drug. You are complying to what I did, the description I gave to you or the prescription I gave to you. But in HIV, we stress on what we call adherence. Adherence means that you must keep to the particular time of that drug. If you don't keep to a particular time of that drug, no matter you are still taking the drug, but it's not working. Now, let me give for instance, if you choose to be taking that drug by 8, you must keep to 8 a.m. Once you take it by 9 or 8:15, it's no longer working. Because within that 24 hours, that drug, once it's out of the system, the virus becomes strong to fight. Because that drug does not kill those viruses, it suppresses it. And whenever once the drug is not the system to suppress it, the virus gets up. And once it gets up, it multiplies fast because he knew that you are coming to take something that will suppress it. So for that reason, we ask them to keep adherent to the drug. Don't ever move the time. If it is 9, keep to 9 a.m. Don't add 10 minutes, don't minus 10 minutes. But some people, they don't keep to that. When I work with that unit, I was a focal person of that unit. Most of the women, they don't. And I asked them why. They say the drug has its own side effect that is affecting them. So na ha jizi uche aṅụ ọgwụ uche na-eji uche aṅụ ya sister asị sister eji uche aṅụ ọgwụ ọ bụrụ ọgwụ a na-aṅụ ya uche ka eji aṅụ ya. So that is it. So what I mean by eji uche aṅụ ya is that you use your mind, that is, you think about how you would drink it. So the woman now told me that. I asked her, what do you mean by that? You're using your mind to drink it. That when she take it in the morning, she wait for 2 days before she takes another one. And after that, she take another one so that and I told her, oh, madam, you are really taking the drug, but you're not adhering to the instruction. So each time you do with their viral load, you will see that it stay high. Each time you do it, instead of going down, it stay high. And once the viral load is still high, you discover that once she have any sexual intercourse with anybody, automatically the person will get it. And this is why it's increasing at the part. So we need some health workers, health personnel, to be in that unit, to be able to address this important adverb, adherence to treatments. Because if they are adherent to the treatment, you see that rate will reduce in terms of those who decided to come to the hospital and want to take drug. Aside that, there are people that guessed it. They don't want to take drug. They knew they get it, but they don't want to take drug.
Really?
I have one experience. Yeah, I had one recently that she came to the hospital with so-called his friend, and I did the test. The friend, because the friend had it. I now asked her, I tracked her to do the test. I did, she had it. His friend said to take drug, but she refused.
A male friend?
The boy took the drug, but the girl refused, telling me that it's not her portion. In the initial time, she told me she does not have money to be enrolled. I told her, okay, let me see how I can ask some philanthropists to pay for you so that you'll be enrolled. She said no, that is not her portion, that she does not have the drug. So that is there, she can't take the drug and she's not taking. Up to now, I'm talking to her, she has not started. And each time I see her, I will see all those signs and symptoms in her body. But what can you do? You can only force the horse to the water, but you can't force the horse to drink the water.
Wow.
Yeah.
Currently in Nigeria, which gender has the highest rate of HIV?
In Nigeria, we all know that women are vulnerable and their bodies are open, so they are the one that gets it higher than men. And also, the existing men had one of these, a kind of cell that men have, some men, not everybody, that makes them not to contact the disease fast. And their body is not that open as women are. So women get it more. And because of the situation of things are hard. So most of our women goes from one place to other, looking for a way to survive. What we call today promiscuity. So that is it.
I heard someone saying that there's a drug you can take before having sex. If someone is having HIV, you won't contact the HIV. What do you have to say about that?
I don't really know about that. But what I know is drug you take after that, which we call PPE, post-prophylactic exposure. That is one I know. That you take once you discover that the person you had sexual intercourse with is positive. You cannot take the drug for 30 days to prevent you not having it. But that drug has its own rules. You must take it within 24 to 72 hours. That is within a day to 3 days. Fail to take it within these 3 days, the virus has get into your body and has started multiplying. So you must take the drug. When I work with as a focal person in HIV units, we had this patient that was admitted because we take care of HIV patients and TB patients. There was this patient that was admitted at a TB unit. He had TB. So when we checked, he was also HIV positive. This man was well known. He's a wealthy man, multi-millionaire with a lot of money. So we were like trying to treat him, though he came down when he was already down. So we placed him on TB drugs and certain HIV drugs. He was taking it. So very shortly before the man gave up, he called me and other of my fellow colleagues and handed over some lists, a list of girls that he slept with, over 200 girls thereabout. I was like, what happened? What are we going to do with this list? He now said that we should do what we call contact tricks of this girl. Their names with their number is there. I slept with them. And he slept with them raw, I mean without condom. And he paid each of them 200. So we should trace it. We are like, why did you do this type of thing? Don't you know it's bad? Do you know that you are HIV positive and you went and slept with all these girls? He now said I will not understand that it was a girl that gave it to him. So therefore, he vowed that he must give it to them before he died. So that was what happened. So then I started educating him that there is what we call HIV positive 1 and HIV positive 2. Maybe he had one, I went and stayed with someone who have 2. So you have carried it and added to your own. So that was why he came down weak. That was what I told him. He said it doesn't matter. That what you know that he's going to die. So we should trace these girls. So we went ahead and did our contact trace. Some came, some didn't come. So those who came, we tested, they were positive. So we placed them on the drugs. So I'm just sharing this experience so that our girls will have to be careful, because way forward is as abstinence. Be faithful to one man. Remember ABC, abstinence, be faithful. If you can't be faithful because of maybe one thing or the other, maybe you did female genital mutilation, use condom. But one thing, what we advocate for, faithful and abstinence.
Okay, why is it that when people have emergency, when they come to emergency unit will reject them and tell them that there's no space?
Depending on where they go to and the nature of the emergency units. If I use where I'm working, Amako Teaching Hospital, find out that our emergency unit has a kind of extent of people in which it will contain, because of the type of the beds that is there, because it's not big and large. So when they have such people and there are many people there, they can't take more than they could. They cannot, because there's nothing they can do. And for instance, there is a day, I think that was sometime last month, where there is an accident case of some people coming from Ogoja. They are coming for what they call it, burial at Anambra State. They had an accident along this Oka Road, Express Road. So they rushed into Amak. When they got into Amak, Amak took the one they could contain, and others were taken to other private hospitals. So that is the thing. It's just because of either the place is not big enough or the best they have there is not enough.
Do Nigerian doctors reject patients?
There is no doctor in Nigeria that will reject patients, because one of the ethics, our rules, our ethics is that you should be out to take care of humanity and to save lives. That is one of the last oaths you take as you are graduating. You are out there to save her life and to save humanity. So there is no doctor that will reject a patient. But there are some situations that will make you to reject a patient.
What is the
The situation is that, one, the patient is not complying. If you have a patient that is not complying, if you have a patient that dictates for you what he or she wants and not what you are telling him or her to do, and you have a patient that is difficult, and you have a patient that is already deteriorating and you cannot handle it, needed an area of specialty he has to go to. So you have to refer the patient. So these are some of the reasons which may not be explained to the public why the doctor say, I can't handle you. Because I have an instance, for instance, there is a patient I brought to one of the cardiologists. This patient, the heartbeat, part of the heartbeat is having an issue. So what we call pacemaker is having an issue. I brought to the cardiology specialist. He told me, sister, I cannot handle this case. It's beyond me. So we have to go to another place. So in that situation, I can't say that the doctor rejected me, rather he's beyond his capability and capacity.
Is it true that some doctors will refer a patient to their own private hospital instead of treating the patient in a general hospital or government-owned hospital? Why?
Actually, I will not be able to answer that question. I think doctors will be in a better position to answer it. But I know that sometimes, depending on what the patient wants, you understand? Sometimes it may come from the patient too. The patient will come and meet a doctor in a general hospital. And I tell the doctor, please, when I come here, the queue is too much. I've been here, I came here since 6 o'clock, and they are seeing me by 2 o'clock. I don't want to come to experience this kind of thing again. Two people are many here. I come in, please, do you have a special, a private way I can come and see you? And if the doctor has, he may decide to tell the patient, okay, I have my own day if you want. So when you go there, you now see some of the challenges there, because when you go to private, it's very, very expensive, more than general hospital or teaching hospital. So that is what I knew from my perspective.
Okay, that's good to know. What do you have to say about genital mutilation?
Oh, wow. Genital mutilation is another gender-based violence we have in our country, Nigeria, today. That's really call for all hands on deck to see how we can stop it. Because the last time I talked about the genital mutilation, I discovered that the increase, the rate at which this genital mutilation is increasing in Nigeria is very high, precisely in Anambra State. Before, we used to think it's northern part of Nigeria, but now it is now in southeast. The increase in southeast is higher than the one in northern part. So that makes me to become worried, and I kind of begin to find out why. Why is it like that? So I discovered that why is it more in southeast is because of our social norms. Our social norms, and that's our idea of if you want to feel among, you must do this. And aside that, the people who encourage this thing more are mothers. Most of them, because they did it. So therefore, my daughter must do it, whether you like it or not. So our mothers are into it. Even when they come to the hospital, we, the midwives, we reject it. They will tell him, don't worry, I know where I will take my daughter to. She has to do it. So she will not take her to all these people, tender and traditional birth attendants. They will not cut, they will not do genital mutilation. First of all, I forgot to tell you the meaning of genital mutilation, female genital mutilation, FGM. It's just cutting off the women private part, refers with the genital organ, what we call this clitoris. They will cut it, and that is a sensitive part of a woman. And when they cut it out, you find out that that sensitive part of woman made the woman to enjoy sexual intercourse is no longer there. And this genital mutilation are into 2 or 3 parts. They're into 3 parts. So the first part is that they may only cut that clitoris. Second one is that they will cut the clitoris and what they call the labia minora and labia majora, which all those parts, they will cut it and join. Then the third part is when they will cut everything, sew everything, cover everything, you know, everything will be well sealed. To the extent that sometimes this person cannot urinate, no hole, no open to urinate. This individual can't even, yes, you see that one. If you see it, you will be worried. So the problem is that those girls that undergo this pass what we call post-traumatic disorder. They had a kind of a pain that each time they remember that cut, they feel somehow. Sometimes most of them feel what we call low self-esteem. They can't feel alone. When they come to a group, they will be feeling shy. They want to be, when you begin to wonder. Some even go into alone. Some go into depression. Because of what? There is something that happened to their body. They are no longer feeling fulfillment. Then some feel so depressed. They feel not low self-esteem. Sometimes they feel that they don't belong. But the aim of doing this for them to belong into the society, and now they are not feel. They feel sometimes they feel detached from the society. Then another thing again is that sometimes you see them after doing this, if it's not done very well, then some of them will bleed to death. They will bleed and bleed to death. I have an incident like that. The woman they did it and brought her to the hospital, and we tried to kind of arrest the situation. But fortunately, that one didn't die. But she bled and bled. We transferred 2 to 3 pints of blood to her before that girl got herself. Now, when we ask these our mothers, what are your major reasons why you are doing this to your daughter? When you knew very well you passed through this thing, and you are not doing it to the why. And they say that we don't want her to be flirting about. We want her to be promiscuous when she grew up. But the what they are preventing is even at increased part, because they find that a girl that undergo female genital mutilation turn out to become more promiscuous in the society.
Really?
The question is how? In a sense that she now, that sensitive part has been cut out. She's no longer enjoying the sex. So when she tells this man, she's not enjoying it, and her friend will come and say, I'm enjoying myself today. She will now move to another man, thinking that this man doesn't know how to do it. She will now move to another man. She's not enjoying. She moved to another man, just like that, to see how if she can feel that sense of enjoyment, and it's not there. But not knowing that that part which that made her to feel it has been cut off, has been chopped off by the so-called the mother.
Wow.
So for us to stop it, it's not only the health worker, because we cannot dictate for our mothers what to do to their children. The best way is for them to stand and say no to this and no to that. And if they stand and put their hand and they can say no to it, you see that the rate will go down. So it's something that we need to look into, and so that our girls will not be suffering from this low self-esteem and post-traumatic disorder, and also feeling depressed in life. Thank you.
How can the cost of medical care reduce in Nigeria?
The cost of medical care can be reduced if the government decided to take over some of the hospitals and not make hospitals to be private individual owner. Let it be government ownership. Then the cost can reduce by subsidizing some of the things that have been done in the hospitals. Let's say, for instance, there are some places you go, women who are pregnant, they come to the hospital and they deliver free. So that will make them to be coming to the hospital to deliver. Once they are pregnant, you go to the government hospital, everything is free from beginning to end. It's free. The government pay for them. Then these people who are having one terminal illnesses or the other, just to be made free. There's a place I went to. What they do there in that village is that there is a bona fide member of that village. They sponsor every child from 0 to 5 years that goes to the hospital, irrespective of what you are doing. Once you go to the hospital, if you are, whether they did do surgery, you are sick or whatever, they just bill it to their bona fide member and he pays. So it's meaning that 0 to 5 years of every child in that village will now want to go to the hospital to access medical treatment and not taking native drugs. So if the government can do that, it will be plus credit to the government. If they can take care of 0 to 5 years and also take care of pregnant women, you see they will be accessing the hospital. So government should do that. Aside that, in addition to that, government should also put hand into what we call this NHIS, National Health Insurance Scheme, that they have started, where we put money into one pool to solve problem of health. It's working, but you need to work more, because most of for interaction we had with people who are into this NHIS, what they used to say is that when they go for the drug, those who register, when they go to access the drug they will give them is either the drug is not what that is effective or efficient, or maybe the drug is about to expire, or sometimes they even tell them they don't have the drugs. So sometimes it become worrisome to them that the NHIS is not working effective. So government should look into it, if possible, set up a team that will supervise that NHIS because it is really helping to an extent. Thank you.
Before we round up, last time we had a guest here, the guest mentioned that, and I quote, nurses and doctors are heartless, especially nurses. What do you have to say that? Because nurses did not attend to him when he was sick.
Wow. I am also a nurse, and I don't think that word is good to be used unless it's very big and ambiguous to say that nurses are heartless. Because we mean when somebody is heartless, it means the person does not have heart at all. And yet the person, nursing profession is a vocation. It's a call to save life. So I don't think nurses are heartless. But some situation will make a nurse to appear as if she's heartless. Now let me give you a scenario in a government hospital. In a government hospital where there is lack of manpowers, the lack of nurses, you discover that one nurse to 20 patients. If you're on duty, you're one nurse to 20 patients. And how can you attend to 21 person? I mean, you're a human being. So if you attend to 1, 2, 3, 4, 5, 6, 7, 8, besides the 10, if the other person, if they come, you will not be able because you too, you need strength. You also need to revitalize yourself. You're a human being like them. So when you don't attend to other persons, they will feel that you are heartless. No, you are tired. You are worn out. You are stressed up with the work. So what we need is that we need more manpowers. And not only bringing manpowers to work, also pay them well, take care of their welfare. Because you want somebody to work for you, because what we are producing is not product, it's services. And these services is in their head. So if you take care of the person will be able to give you the best. Whereby the welfare of the nurses are not taken care of. Their health are not taken care of. No plan for them. They will be hiding those services for you. They won't give it out. Even if they will give half measure. But if you take care of those things, you see them giving you the best. So we are not heartless. The work is too much. It's really weighing us down. So thank you.
Why are nurses and doctors running away from Nigeria? And if you have the opportunity, are you going to Japan?
Wow. Everybody needed a better place. Greener pastures, they said. Even you that is interviewing, if you see a greener pasture, you also want to go. So, if the nurses and the doctors are well paid in Nigeria, their welfare, everything about them is being taken care of. I mean, nobody wants to run away from a place he or she is a citizen. Because when you're a citizen, you're a bona fide member. You have all the fundamental rights. Going to another person's country, you have to start afresh. Why you have to key into some of the rules and regulations they will expose you to because you are into somebody's country. And secondly, you face some of racism from them. So nobody wants to go and face all those things. But because where you are, your country are not being paid. You go to school, spend a huge amount of money to study nursing or doctor, you come out, you are working in the health sector where you are being overused and overwhelmed because the work is really stressing and overwhelming. So after doing those work, at the end of the day, they will pay you peanuts. You go home, you can't even take care of your wife, can't even take care of your children. If you are sick, because sometimes we face hazards. We are treating infectious disease, you can contact it, especially during the time of Ebola, time of COVID-19. A lot of the health nurses and doctors contacted it. And today, some died, and their family, their wives and children, nobody is talking about them. So, if you have a place that work is well planned, they are being paid, even the health hazard is being paid, nobody will run away. You see that they will last and work. But the government are not saying anything about it. That is why everybody wants to go for a greener pasture. Where he or she will go and make the money, they'll make money and come back and last. So please, I'm using this opportunity to talk to our government. Look into it because when they all run away, we will not see who to work. And if we don't see who to work, sickness, they say inevitable. We cannot afford it. Anybody can be sick today. It may be me today. It may be you. If I'm not affected, you will be affected. You will also. If I'm affected, you will be infected. If I'm infected, I am affected. So let us all see how we can do to keep our nurses and our doctors with us so that they can take care of us and we can live long. Thank you.
Okay, can we have a short idea of how much government pay their workers in a government hospital and why you feel like it's too low? Some workers in some hospitals.
When you say the amount, I don't really understand what you mean by that.
The random salaries that some nurses include.
Oh,
Not necessarily your
it's
hospital, not necessarily.
necessary in the hospital. I don't really know because in the hospital they have this their structural payment skills they call cohens. Some place they call it commence. Some place they call it levels. So these things are, they know how they structure it. I don't know. But I know that if you have a double qualification with BSc nursing, they place you in cohens 8. If you have only double qualification, they place you in cohens 7. Then if you have maybe one qualification, then they could place you in cohens 6, depending on qualification. So work is not, the amount they paid in government hospital in Anambra is not the same thing in Imo State, it's not the same thing in Enugu State, it's not the same thing in any part of the country. Depending on this, their cohens, commence, and cahoots, all those their structures. So a structure based on the states.
Okay. What is the random prizes?
I wouldn't know honestly because I can't say based on it's just that I say the structured is what will determine. So if you come to Nigeria, if you come to Anambra precisely, if you cohens 8 is, let's say cohens 8 is 200,000. That cohens 8 in Enugu maybe 300,000. That cohens 8 in Imo State maybe 350. So you see the structure is quite different. Determine what they are using to structure it. Sometimes it may be the cost of living in that place. Sometimes it may be house rents and all those. I don't know what they are using to structure it, but the structure is different.
Okay, thank you very much. Is there any other thing you have to say that maybe any question I didn't ask you, you want to let it out before we round up?
I think you have exhausted all the questions. But what I want to really say in a nutshell is that the government should look into the health sectors. It's very important because this idea of a way running out, going to when you are sick, they say you go to US for medical treatment, you go to India for treatment, you go to this for treatment. If you put our hospital in order, we don't need to be traveling to all those places for treatment. So we can assess those things here because we have the professionals. We have all those that have the skill. We have what it takes. Just what we need to put those equipments there and send people to study it, how to do all those, make use of those equipment. And you see that we have a good health sector. So let us stop running away. We should come back and put our house in order. Because during that COVID-19, find out everywhere shut down. Find out those that used to run away were able to stay in Nigeria. And then they knew the importance of health sector. So please, we should put hand on deck. Thank you.
Thank you very much. Thank you for coming to Adult Gist.
Thank you. I am still Reverend Sister Elizabeth Ume. This is Adult Gist Podcast. Keep watching.